Is it one? Okay. Hello, I'm Dr. Murray Susser. This is my book, Solving the Puzzle of Chronic Fatigue Syndrome, a book I co-authored with Dr. Michael Rosenbaum. And that isn't exactly why I'm talking to you right now. I'm talking to you right now because I'm having an open house at my new facility in West Los Angeles. I'm working in Dr. Perry's office at 3283 Motor Avenue. I have a beautiful new suite with an excellent room to do intravenous therapies with non-toxic substances like vitamin C and calcium EDTA and glutathione. There's a number of wonderful things that we can do intravenously, and that is a fascinating part of medicine because you would think that if it's intravenous, it's not really alternative medicine. It's not integrative medicine or holistic medicine. But that's definitely part of holistic and integrative medicine. What does integrative medicine mean? How do you define holistic and alternative medicine? Well, I define it as all-inclusive, and therefore it includes the use of any modality to its reasonable limit or to its safe limit. So safety is always the paramount goal, and if you have safety and a possibility of curing somebody who's been to many doctors, has been disappointed many times in trying to get better from what most people who are sick have: fatigue, pain, and often brain fog, clouding, various kinds of debility. So here at my clinic in West LA, what I do is I use my 40 years of experience to help people find little clues which sometimes lead to big discoveries in their overall health and well-being. And sometimes it's really almost laughably simple, and sometimes it's horribly complex, because these diseases that people have, like Lyme disease and chronic fatigue syndrome, are very difficult to ferret out if they don't jump right out at you. But sometimes it's remarkably simple. I had a patient who is a very attractive lady, very smart, very proactive, and she had been sick with muscle pain and fatigue for years, had been to her count 64 different doctors, and nobody had found a way to help her. I did a thorough physical exam on her, and when I was examining her neck, I happened to touch her chin, and she winced, and I said, "What's that?" And I got a glove and felt inside, and her gum was very sore and swollen under one tooth. So I examined the tooth, and it felt very difficult for her. It was very painful. So I sent her to a dentist, colleague of mine, had x-rays taken. They found an abscess under the tooth. Had the abscess drained, gave her injections of Lincocin antibiotic, which penetrates that kind of tissue very well. And her pain was gone in a couple of weeks after years and years of pain. So that seems ridiculously simple. Why didn't somebody do that prior to my doing it? Although a lot of doctors don't do much in the way of physical exams anymore. They think the blood test will show everything. And I found that the physical exam and the therapeutic trial, and looking for the clues, the little clues that will give you the answers that you desire. So it's sometimes strange. I do hair analysis on patients, and people make fun of hair analysis because they say, well, it's not real scientific. But we take the hair and we send it out and they analyze it for the minerals, particularly the toxic minerals like lead and cadmium, mercury. And if somebody's high in hair mercury or hair lead, there's a very good chance they have high levels of these toxic metals in their body. And so I had one patient who I did a hair test on him, and he was a young man, 38 years old, I believe, and he had he was early premature gray, but he was an industrial hotshot. He had a big job in industry. He was looking to be CEO of big companies, steel trap mind, fantastically effective, and he was starting to lose his memory, and he was having lapses. And when I did the hair analysis, I didn't know what to expect, but the hair analysis was loaded with lead. He had huge amounts of lead in his hair, and he wasn't taking any lead. He didn't know what was going on. He was using a formula to darken his hair, his prematurely gray hair. He didn't want to look too old. And we found that the substance that was darkening the hair was lead. And we stopped that, of course. We stopped his, and I gave him chelation, a process that takes toxic metals out of your body. Chelation is spelled Chelation. It is a standard treatment for lead poisoning. He was not officially lead poisoned. He was lead burdened, but he was losing his memory for some reason. And when we started chelating him, giving him an intravenous treatment twice a week, after a few weeks, he started to improve, and he got his memory back ultimately, completely. So that's the kind of thing we're talking about. These don't fit in the parameters of normal medicine, conventional medicine. And so what I call my medicine is blending the best of traditional and modern medicine, traditional and alternative medicine. So I think that's what we're aiming for, and this is just a small sample of the information that is available and the processes and possibilities that we have to offer. Thank you.